Medical Legal Partnership is a wonderful program where clinical providers and poverty lawyers are coming together to work as a team to improve the health of vulnerable populations by working in prevention to address issues that appear in the clinical setting but that providers aren't equipped to respond to or to address.
You have a medical provider concerned about her patient, and then you have a patient who has things going on that's affecting her health. And with just a little bit of intervention on our part, we're able to help her think about a future for herself.
Robert is 20 years old now. He was diagnosed with Duchenne's muscular dystrophy at the age of 5, and it's been really hard on us. But every day it's a challenge, and I still look up and say, I have to do this, it's what I have to do. I've had a couple difficulties throughout the years, whether it's been with housing, my son's Social Security, and DTA benefits. And I've needed help from lawyers, and Dr. Nazarian has referred me to them, and they've been able to assist me through the process.
Our caregivers at UMass Memorial are some of the most highly trained, compassionate caregivers you can find. But sometimes they face truly difficult and persistent social and legal barriers to improving the health care of their patients. For example, they might have a child with really severe asthma who keeps coming back to the emergency department because there's mold or poor quality housing. A doctor or a nurse can't fix that situation. A lawyer can.
So the idea behind this new partnership is to increase the number of attorneys who are part of this mission and who can be working with our families.
The opportunity that we want to provide to the pro bono community is to take on discrete, small, and short in time legal cases so that they can continue to be the excellent private lawyers that they are. And so, to those folks who might want to do pro bono, we can find a pro bono opportunity that's going to fit the time that you can give.
One of the best ways to really explain how this works is sharing the stories of the people we serve. She was a survivor of domestic violence and was referred to us because she has been living in a shelter, escaping her abuser, and had applied for public housing to start over in a stable housing. And periodically she checked the wait list to find out whether she was still on, and then found out that she was removed from the wait list because she didn't receive documents sent to her. Her stress level increased, and so it started to affect her health. And so a medical provider referred her to us. Because she was a survivor of domestic violence and homeless, she fit within a priority that can move her up on the wait list. And with a couple of hours on my part, this lady was able to move from 67 on the wait list to number 2. And within 3 weeks of being referred to us by a medical provider, she got an apartment.
We see many of the patients who find themselves in those circumstances are children. Or senior citizens, our frail elders. They may be veterans coming back and facing challenges reintegrating into our communities. They may be recent immigrants and refugees.
That's also why the partnering piece is so important. If I sat here trying to find every community resource and tried to be the social worker and the care coordinator, I wouldn't be able to care for the families and the families that need me as a physician as well.
And understanding that life doesn't come easy for everyone. In certain situations, especially if you add health challenges to situation, it can change the life of anyone in a short period of time.
Low-income communities have a lot of different barriers that they face that you and I might not face in our lives, and they often need help.
I was working for Dunbar. I was driving armored trucks. And I had to give up the job because I was driving from Webster to Lowell. And I was using my full-size van for that, which is basically a handicap-accessible van that I have for my son's needs. And when I saw myself using his van, I felt uncomfortable because if that van damages or anything happens to it, it's pretty expensive, you know? So I wanted to get a car. And I thought, well, why not go into a dealership and try to purchase a used vehicle? I did that, and they told me that because I had these two vehicles that I didn't qualify for benefits. And that was a struggle for me because it's what we live off of. And I was getting stressed out, anxiety, just the thought that, oh my God, I'm not gonna be able to pay my bills. I'm not gonna be able to do this and do that. And when I told Dr. Nazarian about the situation we were facing, she referred me to legal aid.
Families have a lot of struggles even without special needs. Families have housing issues and benefit issues. When you have a child who has complex needs and needs complex care, all of these things are magnified. Every time that Livia and Robert and their family need a new apartment, they have to think about accessibility. They have to think about where they're going to park their van. They're going to have to think about if they can get that power chair out and up the walk, and if there's snow on the ground, how he's going to get out. They're going to have to think about what happens when that van breaks down.
I use that van for everything, to go to appointments, to go to any place that I have to take Roberto.
I love my van because that's my transportation to everything. So if I don't have that, then I have no way of getting by. So the fact that I have that means a lot because without that van, I couldn't go anywhere. I work with the MDA. If they need me for something, they call me and we show up to the events when they need us. We've been to Boston. We went to Stoneham. We went to places like that. I do it because to know that they're coming out with medicines and kids are still walking to an older age means a lot to me because I stopped walking at a very young age. So to know that others can walk means a lot to me because that means that we're doing something and it's working.
And just to see an advancement in, in the medication portion of it, I think it's big.
I believe that you can achieve as long as you put all your heart into it and your mind, you can achieve anything you want. And no matter if you're in a wheelchair, you're not in a wheelchair, you can do anything because what condition you're in doesn't stop you from being who you are.
The hardest thing is seeing him deteriorate. That's the hardest thing for me. It's hard.
How do you deal with that?
I pretty much deal with it in the sense that, like I said before, if this is the life that I have to live, then it is what it is. For the time being, I have to put in my mind that every day that we wake up, it's a new opportunity. And I'm grateful for that, for just waking up. And seeing him wake up every day, it's another blessing.
We recognize that the best way to provide healthcare services to our patients is by treating the whole person. And part of treating the whole person when you're taking care of some of our most vulnerable patients is recognizing their social circumstances and some of the legal needs they have.
If you as a lawyer are able to improve the conditions in an apartment, that apartment is now in better condition for the family that lives in it today, but it's also going to be in better condition for the family that moves in it next.
A lot of families that sometimes are struggling, they don't know that there's help out there for them. And if you don't try, you'll never know. And then having this whole partnership, I think it's going to do great things. I mean, it did it for me. I can imagine the numerous families that it can be an impact on them as well.